Welcome back, Richard. It's good to see you, though you can see my background is all blurry. And
I thought it was me for a moment.
Yeah, you don't have your glasses on. That's what the problem is.
I was going to say I'm nearsighted. I guess I'm nearsighted because all I can see is you.
Yeah, no.
You did that on purpose?
I did. Well, I reoriented the room that we record in, and so my background is I have to get that all set up and everything if whatever I'm going to do with it. So I figured I would blur it out so that it's not too distracting to anyone. So
well, we appreciate novelty. All those of us with, we're novelty seekers. So I'm delighted. It's good. Yeah, it's all good.
That's true. So, but this sort of speaking of novelty seeking, we're going to talk about adolescence today. We're going to talk about youth today and the significance of the youth mental health crisis. And a few weeks ago we talked about the mental health crisis in general and what the COVID-19 pandemic has sort of done to us through our mental health, or for as it relates to our mental health. And so today we're going to talk specifically about youth mental health because it was already a problem.
Exactly.
Prior to the beginning of 2020, youth mental health issues were already a major issue, and the past year has only made it, well, as we're going to talk about, it's only exacerbated the problem. And so, yeah, that's the focus of today's podcast.
Right. Yeah, and it sort of begins with, those of us who are live in the mental health world, regardless of your role or where you are. We are all acutely aware of a crisis. But this article appeared from a publication called The Imprint. It's an independent nonprofit daily addressing mental health issues. And there was an article there entitled, "The World is Watching. Can we finally address our nation's youth mental health crisis?" The implication there, of course, is now that the pandemic has brought this into stark relief, can we finally try to find some solutions to what has been a long-standing mental health crisis in I think all mental health, but especially in child and adolescent mental health.
Right. Yeah. And as you said, COVID-19 has sort of placed the spotlight on a lot of different things. It placed a pretty bright spotlight on some limitations and issues in our education system, in our overall economy and work-related conditions, but certainly as it relates to our health, both our physical health as well as our mental health. And so it's very timely that we're talking about this because we have the immunizations and we have all of this, and so hopefully there's this relief in sight. But it's just a relief as it relates to the physical aspects of the pandemic, not necessarily the mental health consequences.
Right. Yeah, sure. The COVID crisis, the COVID-19 crisis was a physical health crisis. I mean, we all remember the days of not having enough PPE and the fear that emergency rooms across the country, around the world would be overwhelmed, and we just wouldn't be able to, we couldn't bury the dead bodies fast enough. There was a time in New York where the bodies were just stacking up. So this at first was certainly a physical health crisis. But what we're reminded of beginning early on in the pandemic, back in April, May, and June, experts worldwide were saying, okay, it's a physical health crisis, but it has the seeds of a major mental health crisis as well. And we tend to forget about that because all of our emphasis has been on masks and social distancing, and you can't travel and you can't go to school, you can't open buildings. So we were so focused on that. And I think we all sort of forgot that there's a possibility of also having a plague of a mental health crisis, especially in children.
Right.
Because the pandemics sort of exacerbated a problem that clearly already existed. they were here. It was a crisis in children's mental health long before the pandemic hit.
Right. Absolutely. And, and I think there's going to be a lot more research and monitoring and watching as it relates to some of these other aspects of COVID-19. But, there are some early reports that COVID-19, which was primarily respiratory, right? It was primarily a respiratory condition, that there may have been some effects on the brain, that there may have been some changes that were made at the brain level that obviously affect not just physical health, but also our mental health. And so we're going to see how that unfolds over time as well.
Right. And I think what the message here, and one of the messages is that we have talked, and you mentioned this earlier, that we've talked about this issue of mental health in the past. And we always used to figure about 20% of individuals have either any mental health, we use those phrases, any mental illness and severe or significant mental illness.
Right.
About 20% of all individuals worldwide have some type of mental health crisis. Now, during the pandemic, it affected all of us emotionally.
Right.
Okay, and so many of us didn't go into deep depression or deep despair, but all of us were irritated, all of us were angry, all of us were frustrated. So we all experienced some emotional turmoil and certainly lots of distress. But for the 20% or the 25 or 30% maybe who are at risk, this was a major upheaval.
Right.
We've seen many stories about people who had anxiety disorders, for example. One of the treatments was to get out and confront by going out into the world and confront what bothered you. People couldn't do that. So a major part of their therapy, they couldn't even do during the pandemic. And so for people who were already dealing with a diagnosis or who were at risk for a diagnosis, this pandemic had profound effects on their emotional status. And so what this article is about is what was the effect in children? So even before, because what many people say is that the pandemic threw gasoline on the fire of an already existing crisis. So, and what people forget, and I think it's helpful to remind, is that about 11 or 12 or somewhere in that range of youth have been diagnosed with mental illness, but most of them are never identified. And I think in schools we talk about 20%, right? About 20% of kids are struggling with mental illness, and so it's about the same rates as adults. For example, in California, only 5% of youth in their Medicaid system in California is called Medi-Cal. And only about 5% of youth in that system receive behavioral health services that they need. Right. Since 2005, there's been a 61% increase in mental health needs. So we mention these statistics because these statistics existed before the pandemic. There was a 104% increase in suicide and hospitalizations related to suicide. Okay. And alarmingly, there's a 10-year delay between symptom onset and intervention. So if you think about that, you think about a first grader who's 6 or 7 years old, that child's going to be almost finished with high school before that. So they're going to do their entire K-12 education with an untreated mental illness.
Right. Yeah, I think that the really important piece of those stats that you were just mentioning is that, if about 11, 12% of kids, youth are receiving mental health treatment, that's only about half of the estimated number of youth who are expected to have mental health conditions, and that means that there's a huge number of people who are not receiving mental health services that they need. And it contributes to that 10-year gap between the onset of symptoms and the proper diagnosis. And to be honest, it doesn't get a lot better even into adulthood. When you think about something like bipolar disorder, there's a good 10 to 15 year difference between the first major mood related episode, whether it's depression or mania, and the accurate diagnosis. So we're not doing a great job of this, and that is in part because people aren't receiving and seeking services as early and as soon as they should. But the other part of it is the availability of services.
Right. And the other problem with kids, another problem with kids is that you have to pathologize in order to get services.
Right.
And where we're seeing that today is with autism.
Right.
We want to provide ABA services to kids with autism, but you must make a diagnosis.
Right.
And if you don't meet criteria, you can be close, but if you don't meet criteria, third-party providers, third-party payers are not going to reimburse for ABA therapy. And ABA therapy is one of those therapies that you need several times per week. It's best done, daily, but it can be very expensive. And unless you make a diagnosis, you can't get services. And the problem with diagnoses is that most of them are based on adult criteria.
Right.
There are some childhood illnesses, of course, but many of them, we ran into this problem with bipolar disorder back in the 90s and early 2000s.
Right.
There was no childhood bipolar disorder in the diagnostic and statistical manual. And so you're using adult criteria for children, they don't quite fit, and it's hard to make the diagnosis. So you're either overdiagnosing or underdiagnosing. So you have all these problems related to mental health in children and adolescents. But clearly, when we talk about mental illness is really an issue of childhood.
Right.
There's 75% of mental illnesses begin before the age of 25.
Right.
And 50% begin before the age of 15.
Right.
And so when we're talking about mental illness, we're talking about things that begin in childhood, even though all the criteria and the manuals that are written are, most of them, about adults.
Absolutely. And so we do this, we have this tendency to attribute behaviors in childhood to other things.
Right.
To the need for more discipline, to the need for more structure. And some of those things may be correct, but at the same time, we're not, seeking the support and assistance that could help curb some of those behaviors, could help prevent them from worsening, and could certainly provide strategies and coping skills needed to minimize the long-term effects.
Right. That's right. And so we see these data coming in, like 1 in 6 US children between the ages of 2 and 8. So now we're looking at a figure of about 17.5%. 1 in 6 between the ages of 2 and 8 have a diagnosis of a mental, behavioral, or developmental disorder.
Right.
And those things increase with age. So behavior problems start to begin around the time the kids enter school. So we have all these developmental and mental behavioral problems that exist in ages 2 to 8, but from ages 6 to 11, behavior problems become more common. And so the nature of the symptoms can change over time, all right? And so you have to keep up with these developmental changes. And these data, there are pages of data, for those of you who are interested in them, in the specific numbers, provided by CDC. And I think those are in the show notes.
Yeah, I put a link to the CDC website in the show notes.
So despite that we're talking about large numbers of children who are not being diagnosed or diagnosed and not receiving services, despite all that, we're sort of worldwide, we're sort of ignoring the whole crisis. I found this fascinating. 2%, for most countries, 2% of their healthcare budget is devoted to mental health. So you have the entire budget, then you have the budget for healthcare, and then you have a tiny fraction of that, 2%, which is devoted to mental health. And when we talk about international assistance, only 1% of the international assistance goes for mental health problems. Right. And I thought, well, let's see what exists. What about the United States? Let's just look at the United States. Well, we live in Florida, so let me look at Florida.
Yeah.
Because we know in Florida, because we work here, that we are frequently frustrated because we can't get services that kids need.
Right.
Okay. And we all know that. I mean, if you're in schools or working with kids, families need services that are frustratingly difficult to access.
Right.
And so in the latest numbers we have are from around 2019. So this is, again, pre-pandemic.
Mm-hmm.
1,343 Floridians per month are placed on waiting lists for behavioral health services.
Yeah.
Per month are placed on waiting lists. Florida, right at that time in 2019, Florida ranked 48th on access to mental health care. 116,000 youth with depression, diagnosed with depression, were not being treated, had unmet treatment needs.
Yeah.
And if you heard a few years ago, there was a lot in the news about Medicaid expansion.
Mm-hmm.
And Florida was one of many states, so we're not going to expand Medicaid coverage.
Right.
Had they done so, there would have been 130,000 just from DCF who were uninsured,
right,
with severe mental illness, could have received insurance coverage and treatment had Medicaid been expanded.
Right.
So it's not just, we know that these things get politicized, but when you decide not to expand Medicaid, these are the effects that has.
Well, I think that, you know, just to kind of provide an example so folks know what we're referring to here, you know, if I'm seeing it, if I see a kid, you know, parents can typically get their children in to see us faster than in mental health, like therapists. So if usually they can get in to see a general therapist, you know, within a few weeks, typically. They can find someone to see them within a few weeks. However, if they want to see a psychiatrist, you know, so here we are right now, we're recording in June. Just last week, I had someone, I referred someone to a psychiatrist here in town, and they're scheduling new patient appointments in September. Mm-hmm. So it's months before someone can see, and I know some who are you know, scheduling further out than that. September was the earliest. So when we talk about delay in services and the you know, improper access to services, that's the kind of thing that we're talking about. Right. And so parents, of course, are going to become very discouraged. You know, why would they seek mental health treatment? They're going to rely on their pediatricians, and their pediatricians, you know, we talk to pediatricians all the time, and they're not as formally trained as we would think that they might be as it relates to treating things, really anything outside of maybe ADHD. Many child pediatricians are familiar enough with ADHD to provide medication for that, but outside of that, not much.
Right, that's right. And they're the first to tell you that beyond a few medications that they do know how to use, most are reluctant to move into the field of psychiatry because they don't have the training. Right. And they admit that, which is a good thing. And so, yeah, and it doesn't matter whether you're talking about referring to a psychiatrist or, you know, we have families who haven't lost control of their children. Their children have mental illnesses that manifest as explosive outbursts, for example, and they're dangerous or they're destructive, and they need a facility. They need a residential treatment center. Well, residential treatment centers cost somewhere between $20,000 and $30,000 a month. Right. And most who can afford a $30,000 a month? And even the insurers will pay for a month, but you're not going to get anything beyond that. So all you're going to do, if your insurance company even pays for mental health services, and many don't, they'll pay for physical health. They don't pay for mental health services. But even if they do, most are not going to pay $30,000 for a 1 month stay. Okay. Absolutely. And so we have these needs, but the needs go unmet. Mm-hmm. And of course, it's about money. But Florida is a wealthy state. It's a large and wealthy state. Mm-hmm. In 2014 and 2015, Florida ranked 50th in mental health dollars for adults and children. In those years, we spent $36 per patient, per year, per patient. Maine, by contrast, which was number one, spent $410. And I thought, well, if Maine can do it, surely Florida can do this.
Right.
I mean, you go up and down the coasts of Florida, and there's some pretty impressive ambient wealth in this state.
Mhm.
It's not that we don't have the money.
Right.
It's not that the money isn't here. If the money is, if Maine has the money, Florida has the money. Okay, there's no question about that. So it is a matter of political will. So all of this existed prior to the pandemic,
Right.
and since the pandemic, we have exacerbated, or as some people say, we've shown light on a problem that existed long before the pandemic.
Yeah.
In fact, there's a new word. I'd never seen this word before. It's now referred to as a syndemic.
Syndemic.
Have you ever seen that word before?
I had
Syndemic.
not. No.
Right. I don't know where it came from.
No.
But a syndemic refers to multiple interrelated epidemics happening at the same time. So COVID would be considered a syndemic.
Well, COVID and the mental health crisis, those
Right.
two epidemics happening at the same time, that would be the syndemic. Yeah.
That's right, because it's happening at many different levels. You have economic and physical health and mental health and social upheaval, and so this is called a syndemic. Okay,
Right.
and so while we're and Bernie, I don't know about you, but you can feel the exuberance
Mhm.
as people begin to emerge
Yeah.
from the past year, and we're very proud that we have gained control of this. Remember toilet paper shortages?
Mhm.
Remember, you forget about this stuff, right? And every once in a while, you get a reminder that
Yeah,
how
I remember
precious.
walking through the grocery store and you look down the aisle and the shelves are empty. It's not completely foreign to us here in Florida because of hurricanes. So, whenever a big hurricane is coming, you'll see that, the bread aisles will be empty, the
Right.
water aisles will be empty. But yeah, at the start of the pandemic, it was so odd because the toilet paper aisle would be empty and it's
Or-
cleaning stuff.
Yeah, couldn't get hand sanitizer.
Right,
People were
right.
giving away hand, and now you couldn't find any.
Yeah.
Water, there was no water around, and schools shut down. You forget the trauma of when the schools shut down in 2020, and how traumatic that was for everybody.
Right.
So now that we're emerging from this darkness, we're beginning to enjoy our new freedoms, and we're going out to eat. And we were driving somewhere the other night, and there's two restaurants on I-4 near each other. And the parking lot, I thought, why are all these cars here? Well, it was the parking lot for these two restaurants. And so, and you go to restaurants now, and you see empty tables.
Mm-hmm.
You're waiting in line, and there are empty tables. Okay, why are there empty tables? They don't have enough wait staff. They have there aren't enough workers to staff all the restaurants. And my daughter was talking about a gas station that closed, and there was a sign up. We couldn't have anybody report to work for the evening shift, and so the gas station was closed at 6 o'clock. Okay, and so the pandemic. So while we're celebrating our success, it's good to keep in mind that the United States had the highest rate of COVID and the highest number of deaths of any country in the world. We talk about Brazil, we talk about India, but keep in mind, folks, that the richest nation in the world had the highest illness and death rates from this pandemic. And so that should introduce a little bit of humility into whatever we're doing from now on. But we also should keep in mind the pandemic's not over.
Right. We have all these variants, and we have, absolutely.
Right. And there are many people who are not vaccinated, and they are going to be at risk for COVID or the COVID variants. Okay. And they're still not going to get vaccinated. Talked about that many times. Mm-hmm. But so we have to remember the pandemic isn't over yet. There was another outbreak at a summer camp. Mm-hmm. And it was in an area where vaccination rates are very low. And there had 50 cases of COVID reported from a kid's summer, from one of those summer residential camps that kids go to and sleep at. And they had 50 cases of COVID among those children. And they're going to bring that back to other unvaccinated people.
Absolutely.
So the other thing that it did, or the other thing to remember, and many people are, they get a little rankled, they're a little disgruntled when they hear this, but we know about the disparities
Yeah.
between the haves and the have-nots. One of the things this pandemic did is it showed in very stark relief the disparity between rich and poor.
Right.
I remember Katrina, where the people who were in that that stadium were poor. They were all poor people.
Right.
And so we also have to remember that the most vulnerable are also the ones most affected by these, whether it's a natural disaster or a medical disaster.
Right. And a lot of those folks are the ones who, you know, there are children who fall in that range, or in those categories.
Mm-hmm.
And, you know, they are, you know, through childhood and even into early adulthood, you know, these are the individuals who are most likely to suffer from mental health problems for the, you know, some of the statistics that you talked about earlier.
That's right.
You know, with the vast majority of mental health conditions starting before the age of 25 or so.
Right.
You know, these are the individuals who are most vulnerable
Right.
to the medical effects of some of these things, but also then the mental health aspects of all of these issues.
Right. And so, yeah, they're the most vulnerable. They have the least agency. They're you know, they can't do anything about it. They have to rely on other adults, and yet they're the most vulnerable to the very mental illnesses that we're worried about.
Right.
So as we took a look at the mental health effects, the first thing that we discovered was the group that was most affected by mental health issues were young adults from 18 to 24, 25. And they were the most likely to suffer. And the reason is that they call it an endless pause. These are the years when you're making decisions about your education, your career, your relationships, whether to start a family, whether to get married. All those issues occur between 18 and 25.
Right.
And so you have this whole population that it felt like an endless pause. You know, should I go to college? Should I?
Yeah.
I mean, when you think about the turmoil, I mean, going to college, even without the pandemic, is a fairly significant change.
Right.
Now you have that, plus you're doing it in a pandemic.
Right.
You plan to go to college and live in a dormitory and take classes in person with other people your age, and suddenly you're stuck in a dormitory on a computer doing a Zoom class.
Or sent home.
Or sent home. Right. And
So
you're still enrolled, but you can't do anything.
Right. And so, you know, we're at this time in human development, those early adult years, where your brain is still there and kind of wired to have new experiences and to make social connections and to, you know, and to have that's why we're still in education. That's why we're still in college and some of those things during that time frame, because that's what our brain is really wanting to do and needing to do. That's when we're learning all this stuff. And so you take all of that away for a year or more. And so it's not surprising that we see the statistics that we see related to mental health concerns in this population.
Right. That's right. So all that gets put on hold. As a result of that, 63%, and you know, we're talking about all through this podcast, we've been talking about 20%.
Right.
But in this population, 63% reported significant symptoms of anxiety and depression. Okay. And 25% reported an increase in substance use, drugs and alcohol. Okay?
Absolutely.
And so this particular segment of the population was really affected by it. And part of the problem was loneliness.
Which is always a major issue.
Right, right. And we forget that, you know, for married couples, you're still a married couple. And even if you're stuck at home, you have a companion, you have your companion. But when you're a young adult, you are seeking companionship, okay? And that all had to come to an end. I mean, it was hard enough for adults to do without companionship, but it's even more difficult for young adults because that's exactly what they're seeking. They want to be with other people. That's
Right.
what goes out. College students who couldn't return home or couldn't return to campus.
Right.
You know, you go to college and all of a sudden you're stuck at home in your
Right.
bedroom trying to go to college. And learning in isolation. That's not what the college experience was supposed to be about. It wasn't supposed to be a solitary activity. It was supposed to be communal. And lest we forget, the LGBT community was
Right.
especially hard hit because for those individuals whose families had rejected them,
Right.
they had to isolate or distance themselves from their chosen families.
Right.
So many of them had absolutely no place to go. They
Absolutely.
couldn't go back to their families, their inherited families, and they couldn't, because of social distancing and isolation, couldn't associate with their chosen families. So again, it's a subset of a population that really, really was hit hard during the pandemic.
Absolutely. And, you know, and here we are talking about young adults.
Mhm.
But when we look at children and teenagers, the effects were just as great, if not greater. And, you know, the
Right.
reports from, we saw some reports from Colorado, right? Where they're at a Colorado Children's Hospital, there was a 90% increase in the demand for behavioral health services.
Right.
And, you know, suicide in Colorado was the leading cause of death in children over the age of 10. I mean,
That's right.
so over the past year, you know, yes, that's just looking at Colorado specifically. There has been a massive increase in the presence of mental health conditions, but
Right.
Colorado is not the only place that this is happening.
Yeah, you wonder we know that suicide has always been number 1, 2, or 3 cause of death
Right.
in teens. It is the number 1 cause of death in children older than 12, older than 10 in Colorado. I don't think Colorado is the only state that's experiencing that. Okay, but could you imagine if motorcycle accidents was the leading cause of death, or car accidents, or substance abuse? There would be an outcry. There would be legislation, and yet these statistics don't seem to generate the interest, political interest, to address them, to address the phenomenon that we're confronted with every day.
Right.
There's another term called emergency room boarding.
Mhm.
With no place else to go,
Right.
parents go to emergency rooms to
Mhm.
deal with out of control children, children who are having emotional meltdowns, children who are so depressed that parents fear that they're suicidal. And there's been in Massachusetts, there was a 24% increase in ER visits, and 31% for teenagers. The ER boarding, which means you take your children to the emergency room, there's no place to go.
Right.
Okay.
They just stay in the ER.
And there are kids lying in emergency rooms because and that increased between 200 and 400% and in Massachusetts. And then you finally release them from the emergency room and they get put on a waiting list.
Right.
Again, wait for services. Okay, and it can be months before they wait for services. And you
Yeah.
can imagine the concern of a parent who's concerned about suicide, and
Mhm.
it's June, and they say, well, yeah, we can see you in October.
Right.
A
Right.
lot can happen between June and October.
Absolutely. And so we need to think about some things that parents and we all can do to help with this, to address these issues, because the delay in services is a reality. The lack of additional supports are a reality, and the effects of all of this on our kids and our teenagers' mental health is a reality. And
Mhm.
so, you know, we need to talk about some things that we can do to help address some of this.
Right. And I would also urge parents, because Bernie, and I know you deal with this every day too. Many parents still, because of this stigma, don't want to think of their children as being mentally ill,
Right.
even though 1 in 4, 1 in 5, 1 in 6 are.
Mhm.
We don't like to think about that. And parents, I mean, currently, many parents say, oh no, it's not depression, it's not this, because they don't want their children
Hmm.
to be labeled in any way. But please, we urge parents, don't underestimate the effects of the pandemic on
Right.
the mental health of your children. It
Absolutely.
has affected them profoundly. You may not be aware of it,
Right.
but it has had profound effects on their mental health it's been across the world, but certainly across the country.
Right.
The other thing, please know that any mental illness and even severe mental illnesses begin in childhood.
Hmm.
Many parents will say, well, what do you have to be worried about? Or, you don't have anything to worry about. We're taking care of everything. You're not really depressed. You're just being self-indulgent. What do you have to be anxious about? Um, that's not ADHD. That's just you doing what you want to do. Um, these disorders begin in childhood, and they have to be taken seriously. Children can and do experience mental illness.
Right.
It doesn't look like adult mental illness.
Right.
Kids have something like bipolar disorder, but it doesn't look like adult bipolar disorder.
Right.
But that doesn't mean they don't have something. It just doesn't look like the adult version.
Absolutely.
So individuals, families, individual parents, please keep an eye out on this, okay?
Right. Absolutely. And and if the problem has to do with the way that we're labeling it, the way that we're identifying it as mental illness, and that
Mhm.
that has this connotation in your mind of something, something horrible or something, think of it as mental wellness. You think about your physical health, your
That's
physical
right.
well-being, and if if you have a fever, you're going to go to the doctor. If if you have some other physical condition, you're going to go see and get support from the doctor, no matter what it is.
Right.
Why wouldn't it be the same if it has to do with the way that you feel or think or behave? It's
Mhm.
exactly the
Mhm.
same thing. And so think of it as wellness.
Right.
You're not well right now. You need to go get some support to get well, and address it that way.
Yeah, even when you talk to people about substance abuse, if you talk to the worst cases of substance abuse, if you talk to their family members, invariably they will tell you this is an illness.
Right.
This is an illness, and we need to treat it like an illness. But it's the same for all of them. But think of it as wellness. I'm going to make you better. I want to get well. I want to
Right.
be mentally healthy. Okay, so it doesn't have to have the stigma that it had. Physical illness doesn't have a stigma.
Right.
Mental illness shouldn't have a stigma either.
Absolutely.
Um, so if you go beyond the individual level and you get to the level of schools, frequently schools are asked to solve social problems and political problems, whether it's integration or healthy eating, or we ask schools to do this work. Okay, when we sought to desegregate back in the 60s and 70s, who'd we ask to do that? Schools, with busing. Okay, we're gonna segregate our culture, our country, by integrating school. We're going to integrate our country by integrating schools. Don't ask schools to shoulder this mental health
Right.
responsibility. They're not equipped to do it.
Yeah.
And that's not their job.
Yeah, it's incredibly, overwhelming, and schools. It goes without saying the schools don't have sufficient resources to be the sole provider of mental health services and supports for all of these issues. Um, they do try,
Right.
and I've worked in the schools for the last couple of years and have seen valiant efforts to try to address some of these issues, and some schools better than other schools, to for honest. But the reality is that it's overwhelming, and they're not, just as we were talking about earlier, that pediatricians aren't trained as psychiatrists. Teachers and school administrators are not trained as mental health professionals.
Right.
Um,
Exactly.
and so while, as a school psychologist, I have 3 or 4 schools that I'm responsible for, that I'm the only school psychologist that goes there.
Right.
So we're talking about thousands of students.
Right. Right.
There's no way that one mental health professional can provide that services to that many students.
Right.
So we can't just put it all on the schools.
Right. Now, schools can partner. They can be a
Right.
partner in this
Right.
issue, especially with sort of low-level mental, mild depression or mild anxiety. Schools can be brought in as a partner, but we cannot, we can't ask schools to assume this responsibility.
Unless we
Now,
give them the funding for it.
yeah, I mean,
And they,
because you're talking about how the state of Florida, after the shooting in South Florida at Marjorie Stoneman Douglas, one of the reactions was to hire more mental health professionals
right.
in schools. But those are not psychiatrists and doctoral or even master's level psychiatrists and psychologists.
Right.
Okay. Because you couldn't afford it.
Well, even with that though, we have mental health facilitators, and they do a fantastic job.
Right.
But one mental health facilitator, again, an individual may have 5 or 6 schools that they cover.
What would be the ratio? What would be the ratio? It would be, let's say, 400 kids in a school. So they're talking about 2,000 or 3,000 kids, and there's one professional. Okay. Right. But that's not surprising, because worldwide, there's one professional for 10,000 individuals. Yeah. That's the ratio. Yeah. So I'm supposed to see 10,000 people with mental health issues. The numbers, those are the kind of numbers we're looking at. But even in a school setting, you're looking at one practitioner for several thousand children. Yeah. And so you say, well, we can't just throw money at it. Well, you're not going to get those ratios down until you hire more people. Right. More people is more money. Right.
And that gets to the legislative types of things that we could do about it.
Yeah, it really requires a financial commitment. We saw earlier that Florida's 50th, the state legislature won't provide money. They won't, because it's what we like to do in this state whenever a political campaign comes around in many states, you hear political candidates promising to cut taxes. We're going to reduce your taxes, or we're going to cut taxes, or we're going to give you a tax holiday. That's good. I understand that makes good political fodder. That's good for your election chances, because people love when they hear we're not going to increase your taxes, or we're going to cut your taxes. Well, this is the result. This is why you have one mental health facilitator for 2,000 or 3,000 students. So again, we're ignoring the problem. Right. Okay. So state legislators have to make a financial commitment. Right. Florida chose not to. Florida didn't. Florida's governor decided not to expand Medicaid. Right. Okay. Well, then you leave about 200,000 people uninsured. Okay. And then, but where are they going to go when there's a crisis? They're going to go to an emergency room. Mm-hmm. Somebody's paying for that. Right. Because that's the most expensive treatment that there is to go to a hospital, and especially an emergency room. Wow. The other thing that bothers, if we look at current circumstances, we've established that there is a real mental health crisis in children and teens. But yet what legislators are talking about are things like critical race theory and transgender athletes. And this transgender athlete thing fascinates me, because state legislators are spending time passing bills to make sure that transgender athletes are not allowed to participate in sports. Right. I'm not sure that anybody disagrees, but you have to wonder, how many people are we talking about? We're not talking about competing for the Stanley Cup or the World Series.
Yeah, a lot of people don't disagree that issue needs to be addressed one way or another, right. But we're spending time focusing on that stuff and trying to, deal with that while ignoring this other stuff, while ignoring the mental health thing. And if you're going to focus on critical race theory and you're going to focus on these transgender issues, that's great. But, give equal time to some of these other things that we know are problems.
Right. If the state of Florida, if the state legislators in Florida truly believe that kids participating in sports is a real problem that needs to be solved, go solve it. But now we have this really large issue.
Right.
Please solve that one too.
Right.
We have a true children and teen mental health crisis across the country. It's not just in Florida. So if you, and I don't mean to preach at anybody, but it's so disheartening to hear all this time and all this energy and all this political capital discussing transgender youth participating in sports. Somebody said the other day, these are high school sports. We're not talking about the Olympics. We're not talking about professional sport. We're not even talking about college sports. We're talking about kids, okay? Okay, I understand, but I agree with you. If you're going to address this problem, please find time to address this problem, because the other problem is far more significant and involves hundreds of thousands of children. There aren't going to be hundreds of thousands of transgender athletes seeking to play sports, of which we want to eliminate them. We're not talking about 100,000 transgender children. We're talking about a very tiny number. We're talking about hundreds of thousands of kids who need services who aren't getting them. Please address that as well.
Right. And that's the issue. That's sort of the bottom line issue, is that there's not enough services. There's not enough facilities for people to receive services. And we're not, when you think about the different systems that we live in, whether it's the education system, the medical system, the juvenile justice system, they don't integrate very well. They don't communicate. They don't. They don't refer to each other very well, and they don't lean on the services that each of them have that can bring their own strengths and their own opportunities to the problem. And so we're left with these pockets of things, of services. The schools are sort of in isolation, and we, as we said earlier, we kind of lean on them to provide all of these services and everything to all these students. But we have to address the issue at the best that folks probably listening to this podcast can do is you got to address the issue at your home, at the house level. And if you have a child who's experiencing some of these issues, start asking questions, start looking for services, ask the pediatrician, ask the school. The school may not be able to provide services, but they can tell you where to go to get some.
Tell you where to get them, right?
So we need to, parents and caregivers of youth who are struggling with some of these things, look for that support and begin that process. Not because, you're thinking something's wrong with your kid, but because your kid needs some help. They need some support to be healthy.
Right. And I think what we're talking about here, California has a model, I think it's in Alameda County, where the director of the program said we need a paradigm shift. Okay, so we have to take a whole new lens. When I talk about state legislative lawmakers, at least consider this problem, because the way we provide mental health services today is on that 50-minute model. Okay, what insurers, it's based on insurance. Okay, so we have private pay insurance in our country. And so when we talk about how do we solve the problem, well, one of the problems is we deliver mental health services in 50-minute allotments, okay, that are paid for by some insurance companies, not all insurance companies. But the insurance company pays. And so you see a family or a patient for a 50-minute slot. We may have to rethink how we do physical or how we do mental health care, how we provide care to more children, because that model doesn't work very well. And so this group in California is looking for alternatives to that approach. That's a big undertaking because you have a whole insurance industry system based on the 50-minute session, okay? And so we may have to take that apart and take another look at it and say, wait a minute, maybe there's a better way to do this so that we get the articulation between mental health specialists, schools, hospitals, agencies, and the legal system, and get them to work in a different way that meets the needs of all the children who have needs.
Right. Absolutely. And those are systems issues.
Systems issues, right.
That can and need to be addressed. And, but hopefully those of you listening to the podcast will, recognize and listen to and recognize your child's needs, and start asking questions, looking for services, and try to get your child the service that is available. Whatever that service may be.
And take your child seriously. If your child is telling you that he or she is struggling, listen to that. Listen to what they're saying. Or if you even sense that they're struggling, I really appreciate when parents say, gee, he's spending a lot of time alone these days, and a lot of time in his bedroom, and a lot of time. Yeah, that's one of the red flags that we want you to be sensitive to. So yes, please find out. At least check.
Right. Absolutely. So, all right. Well, I think that is it for today. And until next time, stay happy, stay healthy, and forget to be afraid.